Thank you for tuning in to the Helium Radio Network. You are listening to a rebroadcast of a previously recorded show.
Welcome to the Insurance Sucks podcast. Yeah, we know it sucks, but you have to buy it, and you probably don't have the smarts to figure out what you need or where to find it. That's why you should listen to Eric and Daryl, brought to you by QuoteSavage.com.
All right, welcome back to another episode of the Insurance Sucks podcast, brought to you from the folks at Quote Savage. If you're looking for a fast way to get insurance quotes for home, life, and auto insurance, go to their website. Home, life, yeah, you're right. Home, life, auto, yeah, home, life, right. Auto, okay, I was right. QuoteSavage.com, check them out, let them know we sent you. They're the sponsors of our podcast, we love it. I'm back, Eric Remel, your host, Insurance Sucks podcast, with co-host
Daryl Stidham.
And we're actually joined by a special guest here in the studio. Ernie, why don't you go ahead and introduce yourself?
Hey, I'm Ernie Bilodeau. How are you doing?
Good. Thanks for joining us. Today, in a very special episode, we're going to be talking about health insurance and why it's important. And just for folks who are listening to this on a replay or later date, it's actually in the month of December. So what's today, December 4th?
So December 5th,
December
actually.
5th.
And we have 10 days left of open enrollment. And actually, Medicare enrollment ends on Saturday, so that would be the 7th, I guess.
Yeah.
So it's that time of year.
Busy time of the year. I know I'm seeing for all my folks that work, my friends that work in the health insurance arena, they're commenting on their Facebook posts about the insane hold time right now to call into the marketplace to get anything taken care of.
Yeah, well, that's why it's important to have an agent for health insurance if you don't have it through work, because otherwise you'll be stuck on the phone for 4 or 5 hours at a time, and you have better things to do with your life.
Absolutely. Who wants to sit on hold, especially with the federal government for that long? It's almost as bad as calling like the IRS or some of those folks.
Oh, it's worse. It's so much worse.
Yeah.
I know a lot of agents. They're on hold, and they're working till 2 or 3 in the morning. Get up at 6 a.m. and do it again right now.
Ugh, that's brutal.
It's insane.
That's brutal. Well, if for all those folks that have tuned in for our previous couple podcasts, podcast number 4. And we've talked a little bit about why you need insurance and why it sucks, as from the name of our podcast, insurance sucks. And for those folks that hear that lovely entry on the way in, it's a great little segue into what we talk about. Yeah, we know it sucks. We know you have to have it, but unfortunately, it's one of those things. It's part of life.
Just have to do it.
Yeah, what do they say? What is it? Birth, the things you have to do in life, taxes.
Death and taxes.
And insurance, right?
Yeah. Yeah, that's really the case. And for those of you who are not American that may be following abroad, for a few years we had a mandated health insurance where you had to pay a penalty if you didn't have health insurance. That has been rolled back. So it's no longer required, but still really recommended. And we actually, fortunately, between Ernie and Eric, have some tremendous stories about why it's important and kind of the struggles dealing with health insurance, especially on Eric's side, because I think we discussed before you're expecting a child here soon.
Yeah.
And
a couple of weeks.
As far as the as the birth and everything else, there's a lot of expense that goes to that. So why don't you let people know what's going on with that right now?
Yeah, I'm just going to say for all listeners out there that don't have any children, if you're thinking about having one, just go ahead and put the numbers down on paper and see how much it's actually going to cost, and that might actually change your your desire to have any children. Right. But a really interesting situation a couple months back, when we found out we were pregnant, the first thing you have to do is, go to the OBGYN and figure out who's going to birth your child and all that kind of stuff if your normal doctor can't, because some OBGYNs don't, do birthing or, have rights at the hospital. So we picked the place we want to have the baby. We picked the doctor, and we went in for our first consultation. And they sit you down. They go, okay, well, we've run your insurance. We see that you have great insurance. Here's your deductible. Here's the charge, blah, blah, blah. But we've determined that if you have your child naturally, this is the amount it's going to cost you to have the child with your insurance. And it was just under $4,000 with our insurance. And I can imagine what it is with higher deductible insurance or worse off insurance. We're fortunate to have pretty good insurance. And you sit down and you say, okay, well, what's the benefit to me prepaying? And they say, well, we'll give you a discount and you can do this and this and this, and then there's no bills to settle when you have your child. You literally get your child, go home. You don't have to worry about seeing us again or paying us any bills.
Seems simple enough.
Right, simple enough. So we say, okay, well, it was a pretty interesting discount. I think it was like 10%. It wasn't huge, but it was enough to make it, $300-400. Okay, yeah, we'll do it. We prepaid, go on our merry way. Well, what most people don't realize when you're having a child, you have to go back multiple times. So you're going back once a month, and then as you progress further along, it's twice a month, 3 times a month, then it's weekly, until you have the child, depending on what trimester you're in. Well, we had a little incident where we had to go to the emergency room because we were having complications. And we go in there, and then a couple of weeks after the hospital visit, we get a bill for several $100s, $500 to $700. And like, hey, what is this? We've already paid our deductible at the other doctor's office because we prepaid for the year. Well, come to find out, the other doctor never met the deductible because they keep all that money in reserve and just bill in batch billing monthly when you go there instead of each visit. So technically, we haven't met our deductible yet, but we've already paid for the full deductible at the first doctor. The hospital says, you know what? We'll go ahead and resubmit this, and they resubmitted it. And at that point, we had it just happened to be the window where we met it. So they paid part of the claim, not all of it. We had to pay cash. Well, we call the first doctor and say, hey, we prepaid the deductible. Really what we realized, in going back to the original doctor was that they hadn't been paying on a consistent schedule, and so we had prepaid deductible. So now I'm arguing with the first doctor over the $400 change deductible that they were supposed to have met and didn't because we prepaid them. The hospital doesn't care. They just want their money. So we ended up having to pay them anyway because they were threatening to send us to collections after like 2 days.
Right.
Because they don't play. They're just like, pay it or go to collections, your choice. So now the doctor's like, well, if there's any credit on your account, we'll give it back to you after the birth of the baby. And we're like, well, no, we want it back now. Well, it's not the way we work. We do it at the end when treatment's done, like after you have a child. We're like, why would you do that? Well, just in case there's another bill, like, for example, you have to have a C-section, and then that's not included in this cost. You have to pay more money. And I'm like, okay, well, technically what we paid was our copays and our deductible up front.
Right.
So if we have surgery, we should be covered. Deductible's met, and we'll have whatever copay is associated with that surgery, in theory, right? Nope, that's not how they do it. So after about 6 phone calls and 5 hours wasted on the phone, my wife just said, you know what? I'm just going to eat the $250. I'm not even going to worry about it. Like, we get it back. We don't. I'm just over wasting my life talking to these people.
Right. And see, that's the amazing thing, I think. It's not like, health insurance is easy to understand anyway. But then the doctors don't communicate with the insurance company on billing. The insurance companies don't communicate with the doctors on billing.
Nope.
No one communicates with you.
No, they point fingers at each other and send you the bill.
Right. Here, pay it.
Yeah, and they're not even nice about it. They're like, pay it or go to collections. And
Right.
I'm like, it's not like we've stiffed you or not paid a bill or a past due. Like, literally, we're a current patient, and you're telling me this is just, you have to pay it immediately or it's going to collections.
Right.
That's their MO.
Well, the fun thing is, and just in case you don't know this, as long as you pay them something, $1 a month, they cannot send you to collections on a medical bill.
Oh, that's good to know.
Yeah. Yeah. So if you get stuck like that, just send them $1. Won't affect your credit score. Here's $1.
That works. Well, luckily, my wife has more patience than I do. I don't have patience for that stuff. She's an accountant, can take time to talk to those people and sit on the phone. I don't have that kind of patience. After about an hour, I'm like, F this. I'm done. I have no interest in wasting any more of my time with you guys.
Oh, yeah. No. I mean, I deal with insurance billing and underwriters all day, every day.
I don't know how you do it. I don't know how you stay sane. You must drink a lot.
Yeah. Yeah.
At work or at home? I'm just saying, because if I had to deal with that, I might have a stash in the office.
I'm not saying I don't have a beer cooler in my office, but I'm not saying
You do.
I do.
It might have soda in it.
It definitely has soda, but I'm not saying that it doesn't have a big Bud Light on the side. But yeah, I mean, yes, I drink. And for those of you listening, if you want to send me anything, Johnny Walker Black is always welcome. Would appreciate that.
Yeah.
Because I'm in insurance, and insurance sucks.
It really does. Hence the clever name of the podcast.
Right?
Well, I know we have Ernie here, too, to kind of share some of his life story. We're almost up on our commercial break, but maybe we can hear a little bit about Ernie and some of his trials and tribulations in the medical arena.
Well, sure. My story has got a happier ending than what you guys are talking about.
That's good.
That's good.
I had a bad Friday night, and I ended up with a pain in my shoulder. Drove myself to the ER to see what was going on, and next thing I knew, I was talking to a cardiologist. He walked in the room. He goes, "Hey, I'm Dr. So-and-so," and I go, "I think you might be in the wrong room. I don't have a cardiologist." He said, "Young man, you're having a heart attack right now." And they wheeled me from the ER right into the cath lab. I had 100% blockage. They plugged me up, wheeled me up to ICU, stayed there for 24 hours, and they discharged me. No permanent damage, so I'm really happy. That Monday morning, I got a bill from the hospital, not the doctor, just the hospital, for $75,000.
Wow.
I should have went to medical school.
Right?
I almost had a second heart attack right there.
Maybe that was clever strategy on their part.
Right? Get him back.
Yeah.
I called my insurance agent. Actually, it was my insurance company. I'm retired from Aetna Life and Casualty. They were first worried about my health. They offered me other services because as a cardiac patient, a lot of people have depression issues. They wanted to send me here and there. Didn't have that, thankfully. But I said, don't worry about the bill. We'll get it for you. Just it's rejected right now because it's such a large bill. We just have to do our investigation. So 2 weeks later, I got a message on my phone. Your bill's been taken care of. You don't owe a penny. So my message is, if you're going to have insurance, have the best insurance you can afford, because some of the stuff they're selling nowadays, the deductible is so high, you have to wonder why you even have insurance.
You would never hit it. Right.
Yeah. It's almost cheaper to save your money and put it in a savings account and just sit on it for a rainy day.
Right, and I wish those were just private plans or like the marketplace plans through the federal government, but in reality, those high deductible plans are on both sides, and you have to be able to navigate that, which again is why you need to have an agent working for you.
Absolutely.
Absolutely. Well, it's time for our first break. When we come back, we're going to talk a little bit more about health insurance, why you need it, why it sucks, as the name of our podcast goes. And you're listening to Insurance Sucks, brought to you by the folks at QuoteSavage.com. We'll be back after this short break. Welcome back to the Insurance Sucks podcast, brought to you by the folks at QuoteSavage.com. Check them out. Let them know we sent you. They give you great quotes on auto, home, and life insurance. Fast, efficient, affordable, and we love them for supporting our podcast. So please go check them out, show them some love, and take care of us so we can continue to do this podcast going forward.
Absolutely.
So today we're talking about health insurance, why you need it, why it sucks. We have our guest, Ernie Bilodeau, in the studio here. We're sharing life stories about really the cost and association and good experiences and bad experiences when it comes to health insurance. Now, I know, Daryl, you recently had a little bit of an experience with a medical device and some fun stuff from the insurance company. I don't know if you want to share that with our listeners.
Yeah, so I ended up getting a CPAP machine this year, which for those of you that don't have one, it's an apparatus that forces air down into your lungs while you're sleeping, so you don't stop breathing and die in your sleep. Right? That's kind of that's the deal with it.
And not snoring is a positive side effect.
It's a positive side effect, but basically they want to keep you alive. And I was told it's like $45 a month. You pay it after a year, you own it. Great, easy enough.
Yeah, easy payment plan.
And that was in March. And then sure enough, we start getting a bill: $500 here, $75 there, $100 here. We're like, what is going on? So we call the insurance company, call the home health company that provided the machine. What is this? Well, this $500 bill here, that's for, the in-home demonstration and setup. I'm like, well, that seems ridiculous, but okay, fair enough.
That's their delivery fee.
Right. Yeah. Okay. Awesome. Because you have to pay, an RN out to go out and set it up for you. And, well, what's this fee? Well, this is for the mask that you have to have when you wear it. So that's not part of the machine. No. Okay. What about this? Well, this is, the tube, and this is for this. I'm like, all right, so what's the actual payment for the machine? Well, it's wrapped up in this other thing here. Okay. We get all sorted out. It all makes sense to us. We pay it. Now, we paid everything in late October. We look 2 weeks later, the payments have been pulled from our account. The payment shows up on the online portal for, the company that we're going through. But we keep getting bills for the same amounts over and over and over again. We're like, what's going on? So I call them, like, what's going on? They go, oh, well, we have our billing system portal has messed up, so it just keeps not posting them correctly. So check back in a couple of weeks. I'm like, are you kidding me? You're a multi-million-dollar company and you can't figure out simple billing? And so my wife is freaking out because she wants everything paid on time, early if possible. And she's had up to here, and it just causes a lot of stress in my household because these people cannot figure out their billing.
Seems to be a trend with a lot of insurance companies, though.
It is. Insurance billing is a nightmare. It is. And I feel like, as bad as auto insurance or homeowners insurance companies are, health insurance companies are really the primary culprit when it comes to bad billing practices. And I get it. It's complicated. You're dealing with codes and everything else. But my goodness.
You have one job. Put a code on a bill. At the doctor's office, and then you have one job, pay it or not. It's not very complex. Like I find humor in insurance companies. I recently found that I have a lot of allergies and I have to go to the allergy doctor and get shots. So I've been battling my insurance company over some doctor's visits, that were one visit they pay correctly, the next visit they don't, the next visit they pay correctly, next visit they don't. And I go weekly, and I've been going for 18 months. And when I talk to the billing people at the doctor's office, they go, oh, this happens all the time. Because of the fact that you're billing weekly, the insurance carriers typically don't see bills that frequently for services. So it's common for them to screw stuff up. So finally, we got everything figured out what they're actually supposed to pay. We realized that the shots are covered out of network. So I have 100% coverage. I pay at what they call a small co-insurance. $1.40 is what I'm supposed to be paying for every one of my shots. 100% covered, don't go towards deductible.
Perfect.
Then I get a bill for $500 in change from the doctor's office outside of the deductible, and I'm like, what's this? Well, that's the vial, the serum that we put in the shots. I'm like, wait. The shots are covered, but the fluid that goes in the shots isn't covered.
Right.
How in the hell does that make sense to a rational person?
Well, so you're paying $1.40 for the needle and the syringe.
Right, that's it.
And the CNA or wherever.
Yeah.
Right?
But what goes in it, regardless of what's in it, doesn't matter what's in it, that's not covered. So that has to get applied to the deductible. So I'm like, this is the most ridiculous thing I've ever heard of in my life. I can get a shot and only have to pay $1.40, but I can't get anything in it because that has to be paid full price because I haven't met my deductible.
So all they really want you to do is get a pulmonary embolism.
Yeah. So then they tell me $297 a vial per arm, right, for my allergy shots. So then I say, okay, what's your cash price? And they go, what do you mean? Well, if I don't have insurance, how much is it? It's $99 for two. So I stop for a minute and I look at her and I look back at the other lady. I'm like, are we really having this discussion right now? You want me to pay you almost $600, $297 an arm for this vial for each cash because I quote unquote have my deductible, but you won't charge me $99 a piece for the cash price?
Right.
Okay. I'm no longer a patient there because they've irritated me beyond all belief because I can't figure out billing. But they're a very large local, 12, 15 offices, 50, 60 doctors working for them. It could give a crap less. They don't care.
Right. And so what I don't understand, and maybe Ernie, you can help me with this. Why do doctors charge differently for insurance versus cash?
It's because the insurance companies negotiate prices they'll pay. So the insurance companies pay way less than what they actually get billed. So your doctor might bill $500. The insurance company comes back and goes, you know what? You may charge $500, but we're only paying you $200. And because Ernie is your patient, our client, you can't bill him any more than that.
So in the state of Florida, it's illegal to have what's called a dual fee structure, meaning you charge a cash patient one price and you charge a insurance patient another. It's illegal. You can't do that. So the way around that is what they say is this is our price, but because we have contracted rates with Medicare and an insurance company and this and this and this, that's what they bill. So what they're doing is they're giving you an in-office discount or an office visit discount because they're not doing all of the services. So when you go, like in my past life in healthcare, when you came in and saw a doctor, we would charge you for the initial fee, to come in and consult with a doctor. If you got an exam, you get a charge for an exam. If you get x-rays, you get charged for the x-rays. If you get blood, whatever diagnostic test until you get a treatment, those are all individual fees. If you came in and said, I'm broke, I don't have any money, I really just want to come in, we'd say, okay, well, what's going on? Okay, well, you have a broken arm. Well, we know you have to get an exam, x-rays, and da-da-da-da. So what we're going to do is we're going to give you a special bundled rate that this is not an office visit. This is just this type of visit. We do everything in one and give you a fee. And because they're separate services, they're not considered a dual fee structure. That's the loophole or the way around the law.
Okay.
And that's how they can get away with saying like, oh yeah, we have a in-house discount or a special promotional for this, this, and this, and they give you that discounted price.
So I feel like because there are the different prices, that insurance companies need better negotiators.
Well, no. Insurance companies have the best negotiators on the planet.
They don't negotiate.
They don't negotiate. So coming from healthcare in a past life, what the insurance companies do with us, if we took it. So later in life, when I purchased the healthcare clinics, we were in every network. By the time I had sold it, we were out of every network. We basically took cash only and we got out of everything. Medicare, Medicaid, all the insurance carriers. So it cost us physically to administer an office visit. When you come in and saw a doctor for treatment, $29. That was our hard cost for you to see the doctor. Overhead, staff, everything. That was the minimum. If you were in the office for 5 minutes, it was $29. Our contracted rate with Blue Cross and Blue Shield was $12.50. So we lost literally almost double basically what we were getting reimbursed from the contracted rate with the insurance company. And the insurance company, when you call them, there's no negotiation. Do you want to be in our network? Yes, this is the rate we pay for that service and network. Period. You don't have a choice. Take it or leave it.
Okay.
By the way, if you want to be in our network, there's a waiting list of 3 years, and there's 500 people on the list in front of you. So do you want to get added to the list? Sure, I'll get added to the list, and then you never hear from them again. And that's how it went in healthcare.
Wow.
Yeah, it's awful, awful, awful. So what we decided to do was go cash, have reasonably fair rates that everybody could afford. It is what it is. You want to submit it to your insurance company on your behalf? Great. Here's an itemized bill. Have fun. It's still going to cost you cash right here before you leave. Yeah. And we were able to provide a better service, a more reliable service, and a better healthcare rate when we did that, when we went cash only. Okay. Medicare's the worst. Medicare, they would only reimburse 12 visits a year for the type of service that we were in, and they would reimburse, it was $2.78 or 89 cents, something like that. And then if you had secondary insurance, which covered the 20% that didn't, that was like an extra 75 cents. So we'd make like $4 on an office visit, and our cost is $29. By law, if you are a Medicare assigned physician, you have to take that rate. And if you are a Medicare assigned physician, you cannot turn away or charge cash to that patient. So if we're in network for Medicare and someone comes in and says, I see you're in network, we have to treat them at that agreeable rate. It's illegal, and you can go to jail and you can get fined.
Okay.
So good negotiators.
Yeah, apparently. Okay, now I kind of see why, I know there's a push for part of the population of this country to go towards a single-payer healthcare system. I can see where the pushback is from the companies and the corporations in healthcare because they would get completely screwed.
Yep. Well, see, the insurance carriers carry the risk, as you know, being an insurance agent. But the problem is they don't condition or train physicians how to run a business. So when a physician comes out of school, you got to look at the average doctor is in debt $250,000 before they open their practice. That's for student loans if they don't have scholarships. Most of them don't.
Right.
Between medical, pre-med, med, and then if they have to do, depending on the level of doctor they are, if they have to do residency and all that kind of stuff. Most residencies aren't paid, or some are partially paid. So they're $250,000 in debt from student loans. Then they go to open a business. Well, we know as small business owners, it's at least $250,000 to open a medical facility because you have build out staff, infrastructure, equipment, all that stuff.
Oh, yeah.
So now they're $500,000 in debt before they open their door. Then they have to find a fair and reasonable rate. And by the way, doctors just don't make numbers up to set what they charge for an office visit. There is a guide that actually is legislated federally and by state that they can look up and see what they consider a fair pay range for that particular service. Doesn't mean the doctor's going to bill you for that. It just means that what they can set their price at. So, if they know an office visit averages $125 in your city and your zip code by all the other providers in the area, then they may say minimum price is $125, but that doctor may charge $300 for that. Doesn't mean he's getting paid. It just means that's what he's billing.
Right.
So, there's a lot of things you have to think about that go into that. So the doctors are struggling because they have massive overhead. The insurance companies are struggling because they have all the risk and they're trying to cut their overhead. In the meantime, the only one that suffers is the patient because they have to figure out how to navigate that.
Which makes sense why most of the larger companies are going toward virtual docs.
Yeah.
Yeah.
It's genius. It makes perfect sense. If they can drastically reduce the overhead and they're able to treat most stuff virtually, that's great. It's a great model. The struggle is, though, some things that you can't treat virtually, could be a struggle for a lot of stuff, but then, not every system's perfect.
Right.
There's going to be ebb and flow with everything.
I know my daughter just got health insurance, and part of her plan is virtual doctors or telemed. So they suggest that she first make the phone call, talk to the nurse, and see if they can resolve the problem over the phone. And if she can't, then they send her to the doctor and they pay that too. So it's for her, it's the best of both worlds.
Yeah, that's smart.
Yeah.
Especially if you have children, I think telemedicine's great because as a busy parent, you have to take a day off of work, take your kid to the doctor, go through that whole process. If you have telemedicine, hey, my kid's got a runny nose and crying, sore throat. Oh, okay, it's probably this. Here's amoxicillin or whatever, and prescribe a right over the phone.
If they have the sniffles, and you go to the pediatrician's office, they could get strep throat.
Yeah,
and now it's so much worse as much as staying home and saying, "Oh, you have the sniffles." Take some Motrin and call it a day.
Well, not to mention the fact you can, in my opinion, I don't know if this is true. I don't know any metrics of it, but I would imagine it speeds up the medical process because most people don't go to the doctor immediately when they get sick. They start to get a runny nose, they wait a day, and then they go, look, I can go to the walk-in clinic, and then you got to wait a day there, then you got to get medicine. You're 2 or 3 days behind your cold. The second you're not feeling well, if you can jump on a telemedicine call, hey, I got a fever, my nose is running, I just started feeling crappy 4 hours ago, what should I do? Right. Here's a medication, and it reduces your downtime.
And it's cool. They ask all the same questions. It's like, did they have a fever? What is it? Have them cough into the phone if they have a cough so they can listen to the cough.
Right.
I mean, it's pretty incredible. They do. It's not much different than when you go out to the doctor's office, except the doctor isn't actually listening
to your heart, to your back, to through the stethoscope.
So they do a pretty good job. My daughter's very pleased with it. She's had very good luck with it. She's got 5 kids, and she's had very good luck with telemed. But she's also been to the doctor and the ER. So she's used all the services.
Right. Yeah. And one of the things I find interesting about that, too, is as we start to advance as a society, if you can reduce the flow or the traffic, the foot traffic of a lot of that stuff, in my opinion, you're going to reduce the overhead of the insurance carrier as well as the doctors. Because now they have less staff, less people on the back end. So if anything, that might actually decrease the cost of insurance.
Let's hope so.
We hope. But we're out of time for today. I know we got into an interesting discussion about health insurance and all this stuff. So if you don't have it, we urge you to go get it. Marketplace, you said closes next week?
Yep. We're 10 days out, so the 15th of December.
Yeah.
Call your teledoc.
Yeah. Call my teledoc.
But yeah, you've got 10 days for the marketplace to get insurance. We've got, there's all kinds of options out there for you to look at. And luckily, there's no longer tax penalties for not being enrolled. But honestly, I think it's silly if you don't. If not, are HSA still a thing?
HSAs, yes, they are.
Yeah, so I mean, if you don't have insurance, go get an HSA. Save your money. It's
a lot of
tax-free.
policies have the HSAs included in them now.
Oh, that's good.
Which is a great tax benefit, but that's not for us to discuss right now, this minute.
Yep. So. Yeah, exactly. Well, thanks again for tuning in to the Insurance Sucks podcast. Really appreciate you supporting the show. Make sure you visit our sponsors, QuoteSavage.com. Give them some love. Tell them you heard about us on Helium Radio, and they'll take care of you for all your insurance needs. Thanks again, and have a great week.
Thank you for listening to Helium Radio. The views expressed by show hosts or their guests are their own and should not be construed in any way as advice from Helium Radio. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our website. Personal perspectives expressed by the producers, writers, and editors will always be presented as such. Any rebroadcast or retransmission without the express written consent of Helium Radio is strictly prohibited. Thanks for listening.